Over my experience in the United States as a Fulbright, I find that we're going actually backwards. We're not actually going to see the medicine first or the drug first. We're going to see the patients first. And that's what that's the first thing that approaches you. So pharmacy is an evolving profession, and whoever doesn't want to evolve is going to be outdated. So we need to be flexible. We need to be able to accommodate all different changes. It's not a matter of a decision that we want to go to our colleagues as medical doctors and ask them, what kind of things we can do for you? That's not a choice anymore. It's basically, we have an increased demands in healthcare. We have more patients. I heard yesterday that even with 92 consultants in Cleveland Clinic, we still have waiting times. I heard also that there are also limited resources. I've had the need for organizations. So we need to spread the word among all of us. It's not like one can do everything and the other can just be watching around. Complex regimens and poor adherence. How many of us know our patients who do not adhere exactly right to the medications they are taking? How many know that each one of them taking over 5 or 10 medications at the same time? But in the same time, we need to know that there's a change in health delivery. And it's now a demand for every one of the allied health sciences, including nurses and pharmacists in particular, to stand up to the plate and actually take their roles effectively. So, pharmacist is a key member of the healthcare team. That's not a choice anymore. That's basically a fact of life. So now, it's just not a practitioner who's responsible for the drugs needs for our patients. It's actually a responsible person to achieve definite outcomes. And I remember in one of the presentations yesterday, they said I think it was Elaine's presentation, they were talking about outcomes as an important thing for documentation and for the evolvement of science. If we don't have a definite outcomes that we can measure, we will never be able to actually succeed. Evidence-based pharmacy practice. It's a very nice title, and everyone, I hear in education, that we need an evidence-based practice. That's a great title. But now what about implementation? We don't want to think about pharmacists who work in a very regulated setting like in a hospital. We want to think about those pharmacists who are actually working in community pharmacists, trying to make evidence of everything they do and trying to document everything they do. I don't think that's an easy task for any of them. So what does that exactly need? The first thing you need, you learn, I think, in every allied health sciences, that's what I learned in pharmacy, do no harm. That's the first thing. When you have an intervention, you're not necessarily helping, but you want to make sure you're not hurting. And I think that's the primary thing. But we want to go beyond. We want to go beyond not harm. We want to go to actually benefit our patients. And that means that we need to keep updated with every little thing that's coming in medicine. And for pharmacists, that's quite a challenge because they have to learn a little bit of every specialization that they know. And I think that's a big challenge for them. Evidence-based practice. Evidence is an evolving matter too. What was evident 10 years ago might have changed now, and it might change according to the region. And that's when we talked yesterday about, having our own regional research that actually reflects our own needs and reflects our own interest. And that, I think, is a very important thing. But in order to understand that, we need to understand how we can get this data and what are the tools that we have to actually obtain the data that will be, first, implementable, measurable, and in the same time, beneficial to the whole community, to the whole health community. And I'm going to reinvent the wheel for a little bit and tell you about quantitative versus qualitative. I'm not trying to lecture here, trying to tell you about the exact detail, but what I'm trying to tell you here is while quantitative quantifies and measures relationships between different phenomena, qualitative is maybe as important or even more, because sometimes you don't want to make a hypothesis. You want to find your own hypothesis in order to learn about things. And what I mean is, by interviewing, by having a structured interview, you can learn a lot from the person you are interviewing, and it can open the research arena to new ideas and new concepts that you never thought that it existed in that before. So that's why I would like to encourage the qualitative methods of research, because I believe as scientists we always learned about numbers and we always learned about statistics, but now we kind of newly introduced to the qualitative type of statistics and how we can actually measure people's views and people's ideas and how we can actually implement them in everyday life. Talking about policies, I truly believe that if you want to build policies for this part of the world, you need to have more of qualitative research. You need to ask your pharmacists, you need to ask your healthcare providers what exactly needed to be done. And from all these ideas, you can come up with some new concepts that we can introduce. Okay. Just a quick review about surveys versus interviews. About yes and no and multiple choice answers that everyone feels comfortable to answer in comparison to what, why, how, and then people have to think for a little bit. Now they don't have choices anymore. They have to come up with their own choice, and they have to tell you exactly what they think and how they feel. Which one is more important? Both are important. There are things that eventually we need to quantify and learn the relationship between two different phenomena, and there's another thing that we need to explore more so we can get into that area of research as well. Where does it start? Too many people think it's going to have to start at the level of the Ministry of Health. It's going to have to start at the decision makers. I can tell you with all confidence, teaching in different schools in the Arab world, I can tell you exactly that it's going to start in the school, in the pharmacy school, in the pharmacy college, in the way that we actually present knowledge, and in the way that we actually kind of try to initiate some kind of critical thinking in our students. So if we start right, I think we're going to reach that. It's not about just having the right laws. Going through pharmacy laws in different countries around the world, laws always look perfect, but it's not about the law, it's how we implement it. And if we don't have the right people to implement these laws will always stay in books. So, what do I need to say really? Research. And I'm not talking about research that involves tons of people trying to actually make data look perfect on a paper that they want to have it published in a very nice journal. What I'm talking about, like your own research that actually tells you how you can evolve your practice, how you can actually initiate more, how you can know about your profession. Share this knowledge on whatever level it is possible, and then it can expand at another level, and then people can learn. Don't just include pharmacists, don't just include healthcare professionals. Jabir and Mohammed yesterday talked about how it is very nice to actually coordinate with other professions. But I'm not talking even health professions now. I'm talking about sociology people. I'm talking about statisticians. I'm talking about environmentalists. I'm talking about all these different people that can actually come up with ideas so you can have a multiphasal of the same idea that brings up something better to our community. So we need to take this seriously. My own colleagues always, I ask, can I come to people? And I even asked a few people here, pharmacist background, did you actually practice pharmacy? And I say, oh, I don't practice pharmacy. I think that's very demeaning. I'm above that. I'd like to go to a different type of work. But wait a minute, isn't that what you applied for in the same time? Isn't that what you signed for? If the profession of pharmacy now looks so bad in the Arab world, isn't our responsibility to actually make it look better? Who are us, the pharmacists? We don't have to wait for our medical doctors, colleagues, oh, can you give us please some more prestigious status in the community? Or we go to our decision makers or policy makers, please let us feel like better about ourselves. It's us. If we don't actually make this happening and implement it in our little pharmacy in the smallest village, in the furthest place from the biggest city, then we're not doing any favor. We're not doing any good to ourselves first and to our profession of pharmacy. Thank you so much for listening. And I would like to, if you have any questions, I will be happy to answer them. Thank you very much.